Hello, I'm Dr. David Pruitt for the Joint Telepsychiatry Toolkit of the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. I'll be discussing my telemental health journey. In 1999, I was preparing to transition from my position as president of the American Academy of Child and Adolescent Psychiatry to my new position as director of the Division of Child and Adolescent Psychiatry at the University of Maryland, Baltimore. Around this time, I attended a telepsychiatry symposium hosted by Sick Children's Hospital in Toronto, Canada. During this symposium, I learned how the consultation program at Sick Children's Hospital provided outreach to the distant, remote northern regions of Canada. I learned about the value Canadians place on treating families in their local communities and the cost mitigated by utilization of technology-driven telehealth approach to the delivery of psychiatric services. At one point during the presentation, a short video was played for the audience showing a child psychiatrist treating a young adolescent at a distant site from the psychiatrist's practice. The psychiatrist and the adolescent were engaged in a lively discussion about their golf games and strategies for getting out of the sand trap. I was hooked, not so much on the technology. At that time, I was having trouble managing 3 television remote controls for my Sunday afternoon NFL football. No, I was hooked on the vision of telepsychiatry. I was trained by Salvador Minuchin, the founder of structural family therapy. The philosophy at the basis of structural family therapy is the idea that the root of pathology exists not in the individual, but rather in the dysfunctional family system. My early training fueled my desire to disrupt ineffective child and adolescent support and care structures in order to build better systems of care for children and families. Telepsychiatry has allowed our profession to provide care to children and families who live in underserved rural or urban regions. However, studies have shown that many trainees and even many established psychiatrists have reported feeling apprehensive in their abilities to effectively utilize telepsychiatry platforms and technology and to adjust their clinical skills in order to practice effectively with telepsychiatry. At the University of Maryland, we are using technology and televideo conferencing to promote better systems of care for children and adolescents. We are training the child and adolescent psychiatrists for tomorrow using tele today. We integrate telepsychiatry training into our curricula and fellowship training. Each of our 14 child and adolescent psychiatry fellows have observed and practiced the delivery of psychiatric services via telepsychiatry during their fellowship training, and the experience allows many to see how much more effective their roles as psychiatrists can be with this technology. Our faculty, staff, and fellows are embedded in 25 Baltimore City schools with full-time outstanding clinical staff on site at each school. On Tuesday mornings, fellows travel to the schools, working on site with school clinicians, and when appropriate, providing psychiatric evaluation and medication management services to youth. Spending some of their time on site in these schools, the fellows learn about Baltimore culture, which further enhances their ability to build rapport with these youth when they provide services to them over a telepsychiatry platform in between in-person visits. Delivering telepsychiatry services to children and adolescents in the schools has allowed the fellows to implement the integrative model of getting the right person in front of the patient at the right time using the right technology and evidence-based treatment. Telehealth has allowed our profession to enhance understanding of and ability to promote innovation in health care. Just as Amazon has changed the way we shop and Uber has changed personal transportation, so is telehealth changing medicine, and psychiatry is the leading specialty driving that change. Won't it be fascinating, ironic, inspirational, if technology, so often accused of creating distance between and even isolating humans, allows us to more effectively connect with patients, their families, and underserved communities? I'm Dr. David Pruitt for the Telepsychiatry Toolkit. Thank you for watching.